So in recent weeks, there have been a lot of reports about a product called K2. It seems to be gaining popularity in teenagers and young adults to be used as an alternative to marijuana. And it seems to be marketed as a safe alternative and also an alternative that is not detectable on drug screenings. So I worry that kids who may be in high school, maybe high school athletes who could be subjected to drug tests, would see this as a way to smoke something like marijuana without getting caught. So we're concerned about this because we're seeing a lot of children come in with complaints of chest pains and even some kids who have had real heart damage after smoking this product. We admitted 2 teenage boys within a few days of each other who came in with similar complaints. The first patient came in with chest pain and feeling kind of lousy for a few days, and he'd also had a low-grade fever. While he was admitted, he had an episode of severe chest pain, and the lab values that showed heart damage increased dramatically, and his EKG also showed signs of heart damage. And at that time, we asked him more questions about what he'd been doing recently, and at that point he said he had smoked something called K2. The second patient, I got a call from an emergency room a few days later saying that a teenage boy was there with chest pains and that he had smoked something called K9. When he was admitted to our floor, the cardiac floor here, we asked him what K9 was, and he said it was a stronger version of K2. The first patient showed real signs of a heart attack, and he unfortunately was a high school football player, and we're not going to allow him to play football this year. The second patient showed no signs of heart damage on lab tests or his subsequent EKGs, so he will follow up with his family doctor and they'll determine from there. Well, K2 is apparently marketed as an incense, and officially the manufacturers of K2 say it's not for human consumption, and they market it as just something to be smoked to, as an incense. But clearly people who have written about it on websites and their blogs are using it like marijuana and smoking it in the same way that you would marijuana. Honestly, there's nothing really about K2 in the medical literature, so we've done some searching through various journals to look for other case reports, and we didn't find any. Honestly, the best source for the information was on the internet with a Google search. So this was very new to us, and in the popular press there's been more and more stories about K2. So we here in the cardiology division, as well as people with the toxicology division at UT Southwestern, are going to combine to write up these cases to hopefully get some more information into the medical literature. Well, I think for physicians that would be seeing kids with chest pain, such as emergency room physicians or general pediatricians or general family medicine doctors, I think being specific about questions about drug use is important, specifically asking about K2, because since it doesn't show up on a drug screen, a teenager may be less than truthful about their use of it unless asked directly. I think the take-home point is that we just don't know enough about K2, and what we do know is at least concerning that it could be dangerous to your health.